Well, welcome everyone, and good noon, and I guess morning for some, and possibly afternoon for others. So thank you for joining today's webinar. It's brought to you by the Action Collaborative on Clinician Wellbeing and Resilience from National Academy of Medicine. I chair this collaborative together with my co-chairs, Darryl Kirsch and Tom Nasker. As you know, the well-being of our clinicians is critical as we continue to tackle COVID-19. This meeting focused on lessons we have learned over the last 8 months, and more importantly, how to use this opportunity to advance clinician well-being using a systems approach. May I have the next slide, please? So I want to thank the expert planning committee who put this 2-day agenda together, many of whom you'll hear from, and particularly thanks to Tim Brigham and Pascal Carrion for their leadership on this planning committee. Now, what I'd like to do is talk about the planning, the objectives of the meeting. Next slide. So we're gathering healthcare leaders, frontline clinicians, and experts in order to elevate the urgency of taking collective national action on clinician burnout, an issue that's been exacerbated during COVID-19, and the impacts will be felt long after the pandemic. COVID-19 has affected not only clinicians physically, but also mentally and emotionally. During this moment in history, we see Black clinicians and other clinicians of color face disproportionate risk from COVID-19 and from the structural racism and failures in the healthcare system. As this pandemic wears on, we must also consider the financial impact on healthcare organizations. Many will be forced to take tough decisions and have to make the case for investing in clinician well-being. So I hope this meeting will spell out the importance of addressing these challenges now in a systematic way. All of us have a role to play, and especially on the second day, we'll address how to begin taking steps towards improving or changing the culture for professional well-being. So what I'd like to do now is take a moment to explain to you what our collaborative is for the public audience. So if I can have the next slide. So the NEJM Action Collaborative on Clinician Wellbeing Resilience was founded in 2018. Actually, it started before 2018 when a number of us says this is such a national problem. We really got to get together all the players to collectively do something about this. And the goals of the collaborative are shown in this slide. To raise the visibility of the burnout, depression, moral injury, and suicide of clinicians, to improve the understanding of challenges to clinician well-being, and certainly to advance evidence-based multidisciplinary solutions that can improve patient care by caring for the caregiver. Next slide. So we started this journey by actually creating a collaborative that welcomes people who work in the area. And we quickly have 65 working group participants. They represent a whole spectrum of healthcare sectors: medicine, nursing, pharmacy, dentistry, professional societies and membership organizations, government agencies, health IT vendors, large healthcare centers, payers, researchers, trainees, and of course, patient and consumer perspective. Next slide. So this slide shows you our first job. When we first got together, we asked the question, well, what do we need to do? Well, we decided we'd create a concept model, which is advanced by Darryl Kirsch, my co-chair, to say, how do we understand the issue of clinician well-being, resilience, and burnout? As you can see in this model, we're putting patient in the center because patient care is what it's all about. And of course, clinician on this next tier, the relationship with patients and their well-being. And then on the outer circle are all the factors, external and internal factors, that influence the clinician well-being. As you can easily see, the external factors includes organizational factors, learning practice environment, healthcare responsibilities, rules and regulation, society, and culture. And of course, their personal attributes and also skills and abilities that influence the well-being of the clinician. Next slide. Next slide, yes. So we started working very hard in the first few years, trying to address the external and the internal factors. This is only a summary of lots of things that this collaborative has been doing. I really want to thank the members and steering committee and my co-chairs for putting so much work. The idea, if you notice, is that we actually include not only the clinicians and the organizations that are involved with clinicians, but we also involve outside, like payers, IT vendors, and others. So together, we started working on the external factors, one of which is electronic health record. Stanford Medicine Harris poll, no, last slide, please, show that, in fact, on an average visit, let's say of 20 minutes, the clinicians spend more than 50% time in front of an HR and a computer. That takes away from the sense of interacting with patients and a sense of why they went to medicine. So we needed to find a way to make EHR more user-friendly, less administrative time, and giving more patient time. Workload, administrative responsibilities, workflow, teamwork, all part of the environment by which our clinicians work in. And everybody knows that increasingly there's more administrative work, there's more reporting to be done, and less so in patient care. And there again, we work very hard to balance and rebalance the workload, administrative workload, etc. Power dynamics in an organization, and important leadership engagement. We make the case for chief wellness officer because it's important that any organization have somebody who's really focused on the well-being of the workforce, but working in the C-suite along with leadership to ensure the wellness of a workplace. Next slide. We also work with clinicians to think about how to enable them to have skills and abilities to cope, to have empathy, to have more resilience, and to have expression and communication of their feeling and well-being, particularly the issue of culture of silence, and of course, teamwork. Next slide. And so consequently, you can see that we also work towards a very important area, which is studying what are the real factors that lead to clinician burnout. Now, some 20 years ago, our organization put out a seminal report called The As Human, in which it recognized that the medical errors which are being carried out are not the result of individual faults, but usually system failure. Well, in this study, in fact, led by Pascal Caravan and Chris Castle, really came to the same conclusion, that it's a system failure. And there's 6 goals that we can pursue to prevent and mitigate burnout and foster well-being. Positive work environment, addressing burnout training and early career, reduce tasks that do not improve patient care, improve usability and relevance of health IT, reduce stigma, and improve burnout and recovery services, and create a national research agenda. And you're going to hear a lot more about this today. Next slide. So as we transition into the second 2 years, in 2019 to 2020, we decided that we would look at these work streams. Leadership engagement, so important to have CEOs, Chief Wellness Officer, to look at this issue as central to everything that they do. Break the culture of silence, being able to have people speak up and not worry about the issue of stigma. Organization best practice and metrics. How do you learn from each other and learn from best practice, and how do you measure our success? Workload, workflow, administrative tasks, and EHR, we talked about that already. Sustainability of such a type of work to keep going in the future, and obviously focus on the consensus report where we can actually start acting on the recommendations. Next slide. So importantly, in expression of well-being, we want to address the issue of stigma. We want to have people being able to express the sense of well-being and challenges. And so we have an art gallery, which have tremendous response from our clinicians and others. And this is now a traveling art gallery show. We have a resource page that actually collects all the information, best practices and information to enable people to use. We have public webinars, which is what we're having today, and many publications, including the consent study I just told you about. Next slide. So the important issue here is that during COVID, we recognize that this is really affecting the clinician ever more than before COVID. And so we created a resource in which, as you can see, 119 resources from a range of organizations where one can actually learn about this and figuring out what can be done. We also held a very important webinar on May the 7th. And during this webinar, next slide, we actually invited the family members, the sister and brother-in-law of Lorna Breen, who's a clinician who committed suicide. And the Feist couple spoke to us about the very moving issues about Lorna's life and the stigma that's related to, in fact, having burnout and because of the circumstance in which she committed suicide. It was very moving. Next slide. About simultaneously, my co-chairs and I wrote a paper in New England Journal of Medicine that asked for national action in this area to protect our clinicians' well-being. We argue that Congress should act just like after 9/11, when the first responders were basically physically and mentally harmed and affected by the circumstance, and that there's long-term care for them, as well as, in fact, programs that support them. And so we asked for those, and also a long-term epidemiologic study to look at what happens to our clinicians over time. Now, the good news is there is, in fact, a bill in Congress, in fact, put together and led by Senator Tim Kaine, that's called the Lorna Breen Act, that actually addressed this, and this, in fact, is being now considered in Congress. So hopefully all these will converge to help our clinicians and to support them for their health and well-being in the long run. Next slide. Next slide, please. Okay, so you can hear now that in the last 3.5 years, almost 4, we have convened key players and entities, including non-clinicians and vendors, payers, CMS, and others, to really look at how to address this burnout crisis. And we have 150 organizations that commit to actually addressing this issue. We've convened and groups, we have webinars and summit on the well-being of issues for people to come together to say what we must do about this. We have a knowledge hub and expressions of clinician well-being art gallery. We've collected data and case studies, publications, sector-based infographics, and of course, special projects. And now we talk about special emphasis on the COVID-19 response. Next slide. So I hope that you will all join me in today's meeting, which in fact would be addressing specifically on COVID-19 and the issue of clinician well-being. And let me therefore stop and thank all of you for listening to me, and therefore turn it over to our program co-chair,